Okay, this video is called Why AI Doctors, Artificial Intelligence Doctors Will Suck. And the reason is they have no judgment. They're just going to seek consensus. And when they seek consensus, that means they want to get something written and authorized by the expert centers. And what does an expert center mean? It means a place controlled by a drug company. The big name medical centers, in order for their attending physician staff to get promoted, they have to publish more papers. In order to publish more papers, they need money from the drug company to fund their research. So they basically have to kiss the drug company's butt or they don't get funding. And they can't get promoted from junior professor to assistant professor to full professor. You can get tenure and things like that. So the bottom line is they're in bed with the drug companies. And that's why almost all the standard medical conditions have a protocol based on match the ill to the pill and send a bill. Now, if you don't know anything about medicine, that might sound intelligent, but when you start to learn how medicine and health actually works, it's incredibly stupid. Okay, so what consensus means is mediocrity, lying to the patients to sell them drugs. Now, don't get me wrong. What this does is it generates a standard of care. And you need a standard of care as the lowest common denominator because a lot of patients, they're demented. They're almost demented. They're mentally retarded. They're intoxicated. They're drug addicts. They're totally irresponsible. So what I'm saying is these are people who are not capable of doing anything for themselves. And there's a lot of them. They're really old, fragile, debilitated. They can't read, a one-paragraph article. Believe me, there's a lot of them. And the reason's obvious. People think being a doctor is glamorous. Oh, you get to be a doctor around all these educated people. No, most of the time you spend talking to really sick, fragile, pathetic people. And the reason is fragile, pathetic, ignorant, demented people, they're sick all the time. A healthy walker, talker, intelligent person, they can just become a low-fat vegan. They almost never get sick, okay? So they don't talk to doctors very much. It's the really sick, debilitated, confused people that are sick all the time. The alcoholics, the drug addicts, okay? They're always sick. They're always in the hospital. So doctors spend a lot of time talking to people like that. And you do need a standard of protocol to manage them. People think, oh, drug medicine is so sophisticated. Surgery is so sophisticated. I'm not that impressed by it. You can give a drug to your dog, okay? You could do surgery on your dog. Okay, can you get your dog to read a book and learn something new? Can you tell your dog, I want you to change your behavior, I want you to change your diet, I want you to exercise this much, I want you to go to bed earlier? Your dog can't do any of that. So what I'm trying to say is, diet and lifestyle medicine, at first glance it seems kind of simple compared to drug medicine, but in reality it's much more sophisticated and complicated, and it requires intelligent, voluntary participation of the patient, okay? If you decide you're just going to manage a medical problem by prescribing drugs and that it should be standardized, then that means AI can do it, okay? The drug companies, like I said, they're paying these doctors and scientists to promote their drugs, and the doctor or scientist has to promote their drug. If they don't promote the drug, they'll never get funding again, then they'll never get promoted, then their wife will get pissed off at them and divorce them, so they have to do it. So they're going to do it. And kissing the drug company's butt, kissing the insurance company's butt, that's a lot more important than the patient because the patient don't have any money. All the patient can do is say, thank you. Well, that's nice, but it doesn't pay the bills. Okay? Now, one of the big trends we saw over the last 20 years or so was more and more nurse practitioners and physician assistants replacing especially internal medicine doctors and family practice doctors. And you'll say to yourself, well, why is that? And the reason's obvious. Think about it if you're the drug company. If you're the drug company, you got all these stockholders. All that matters is you please your stockholders. So how do you please your stockholders? You got to make more profit. Now, the whole medical business in the United States, it's the most expensive healthcare system anywhere in the world, even though it's got crappy results. And it's becoming too expensive for anybody to pay for it, even the insurance companies. So what are the drug companies doing? By sponsoring nurse practitioners and physician assistants and getting rid of more and more doctors, you can pay a nurse practitioner or a physician assistant about a third of what you pay a doctor. So that drops the health costs, and the drug company still gets their money. However, if you look at it from this point of view, well, gee, if you're just going to standardize more and more things and recommend for hypertension this set of drugs, diabetes this set of drugs, coronary artery disease this set of drugs, gastroesophageal reflux this set of drugs, dementia this set of drugs, etc., well, you don't need a thinking, judging person to do that. You can just run that through a computer protocol. Patient types in their symptoms. Gets their blood pressure checked, gets their total cholesterol checked. You can just put them into the category of high cholesterol. AI says take this pill. Okay, high blood pressure. AI says take this pill. This way, the cost of healthcare will be reduced even more, and the drug companies will still get their money. And that's the thing that matters. So, all these people that don't know anything try to understand the healthcare system, and they're like, I can't make sense of it. You can't make sense of it unless you consider its real purpose, to sell drugs. If you think of it as a drug dealing business, everything will make sense. Okay? And the drug companies, they're going to get their money. They have billions of dollars. They're going to do whatever they want, whatever they can get away with. It's not going to change. So getting rid of NPs and PAs, they'll have already gotten rid of internal medicine and family practice. Replacing them with AI will lower the cost even more, and it'll also lower the quality of care. But the stupid pros won't even know, and so that's the way it's going to go.